Doctors in Toronto are saying they're noticing a rare illness resembles polio that targets children. It's surfaced in Canada, a disease that doctors have been dealing with of late in increased numbers south of the border. Last week, for example, the Centers for Disease Control reported more than 60 cases of this disease confirmed in the United States in recent weeks. More than 60 cases of 127 cases this year. So a spike in numbers. It's causing concern, and it certainly attracted the attention of Dr. Brian Goldman, the host of CBC Radio's White Coat, Black Art. He's written about it online, certainly wanted to ask him questions about it. So thanks for coming back in studio again with us today. We're talking about acute flaccid paralysis, acute flaccid myelitis. Those are the names for this disease. What is it?
It is, so acute flaccid myelitis, or AFM, is a condition that affects the spinal cord. It usually occurs in the wake of or in the context of a viral illness, could be a viral respiratory illness or gastroenteritis. And it attacks a portion of the spinal cord called the anterior horn that controls movement. And so it is a condition that causes abnormalities of voluntary movement. So there might be a weakness, a limp weakness of one limb, or 4 limbs, or 2 limbs. It's that random. It can also cause droopy eyelids, and it can cause difficulty swallowing, and sometimes even difficulty breathing, which means that in the worst case scenario, some patients, mostly children, end up on a ventilator in the worst case scenario.
And there have been deaths in this most recent series of incidents.
One death in the United States out of the 127.
Exactly. So as you look at the screen, exactly the symptoms that Dr. Goldman was talking about. What causes this?
They're not sure. As I said, it can occur in the wake of a viral illness. Because it resembles polio, there have been a lot of questions, some reports in the media that it might be attached to polio. In the United States, the Centers for Disease Control have investigated that, and they do not believe that polio has anything to do with any of the cases in the United States. So I suspect that would be the same case in Canada. So it can be associated with a respiratory virus or a gastrointestinal viral infection, but they haven't ruled out the possibility of an environmental toxin. And this is a 1 in a million condition. There is a spike, and that's why there's concern, a spike in the number of cases, but this is a 1 in a million condition. It probably does not occur unless the child has some kind of genetic susceptibility that causes this infection or a toxin to attack the immune system or to get the immune system to attack the spinal cord.
Okay. We've talked about how it does affect children, notably 4 is the average age in the U.S., most of them under the age of 15. Why children? Do they have any sense of why it particularly targets children? No.
No, and that's what happens when you have a mystery ailment. That it's so rare that it's something that's an important question. It may have something to do with the fact that the nervous system is still growing and developing at that time.
These are the questions that they seek to answer as these numbers increase. 127 we mentioned in the U.S. in 22 different states in recent weeks. So it's not a cluster. This is more widespread.
That's right, and of course, everybody asks, concerned parents ask, is it contagious? Do you get it by coughing or sneezing? And the answer is it's not contagious because, again, we're talking about a 1 in a million condition. It may be that the child has to contract the infection first to then become susceptible to AFM, but it's not that children are immediately susceptible just because, siblings are not necessarily going to be susceptible just because one of their siblings has it.
Is it in the house? Now, obviously, I keep asking questions based on information from the States because this is where it's been most documented to date, but it is now starting to cause some concern here in Canada.
Absolutely. And the interesting thing is that up until the 1st of August, Health Canada, Public Health Agency of Canada, had received reports of 5 cases, and that is bang on right in line with what they would expect annually. With the number of cases, I had some email contact with senior physicians at the Hospital for Sick Children. They said that they'd seen fewer than 20 cases, but that clearly indicates that they're seeing more than the entire number of cases that were reported to Health Canada up until the 1st of August, and these have all been since August or the 1st of September, which is why they've sent out an alert to frontline physicians. That was how I heard about it in the first place.
Okay, so they are watching for any increased signs. I'm thinking of parents listening to our conversation going, I have young children. What do I watch for? What should parents be concerned about?
So they should watch for, in the context of an acute infection, a child who evidently can't move a limb. But the other things would include droopy eyelids, difficulty seeing because of double vision, maybe difficulty swallowing, but probably the first symptom might be difficulty moving a limb. The important thing is there's a belief that early intervention makes a difference. That means that the doctors at Sick Kids are urging parents to take their child to seek medical attention immediately if they have any of the symptoms that I've talked about.